Physician Quality Reporting System 2013 Group Practice Reporting Option and Shared Savings Program Accountable Care Organization. GPRO Web Interface Assignment and Sampling. Program Year 2013. In this presentation, we will provide an introduction to assignment and sampling, which includes a web interface assignment overview and a web interface sampling overview. We will also discuss reporting on sampled patients and provide a list of helpful specifications documents. This presentation will cover information related to the GPRO Web Interface reporting mechanism. If you are submitting data through another reporting mechanism for PQRS reporting, please visit the PQRS website on cms.gov for more information on how to submit data for PQRS. Please refer to the 2013 GPRO assignment specifications and 2013 GPRO sampling supplement for detail about assignment and sampling process covered in the following slides at this link. Assignment and Sampling Overview. The GPRO Web Interface allows ACOs and PQRS GPROs to report data on a predetermined population of patients. Patients are first assigned to an ACO or PQRS GPRO. Patients are then put into a sample for quality measure reporting. CMS assigns a Medicare beneficiary to an ACO or PQRS GPRO based on current program rules. For Shared Savings Program ACO assignment algorithm, CMS uses beneficiaries assigned for the 2013 third quarter report. For PQRS GPROs using the web interface, the assignment algorithm uses beneficiaries assigned using claims from January 1, 2013 through October 31, 2013. A patient assigned in 1 year of the program may or may not be assigned to the same ACO or PQRS GPRO in the following or preceding years. Assigned beneficiaries who meet additional quality eligibility criteria may be sampled into the GPRO Web Interface modules through a three-step process. CMS analyzes Medicare claims submitted and captured in the Integrated Data Repository from January 1, 2013 through October 31, 2013 of the calendar year measurement period, that is, the reporting period. Patients are sampled using a methodology that would increase the likelihood of a patient being sampled into multiple modules. Step 1. Exclusions. In sampling Step 1, CMS first determines assigned beneficiaries' eligibility for quality measurement. We keep only assigned beneficiaries with 2 or more primary care visits during the reporting period by services, not provider type. Note that CMS will only have 10 months of data. CMS excludes assigned beneficiaries in the following cases: beneficiaries with partial year Medicare Parts A and B enrollment or for whom Medicare is not the primary payer, Medicare Advantage enrollees, those who entered the Medicare hospice benefit during the measurement period, and those not living in the U.S. during the measurement period. Sampling Step 2, Module Inclusion. During Sampling Step 2, CMS determines the remaining assigned beneficiaries' eligibility for inclusion into modules. The GPRO Web Interface includes 22 GPRO quality measures, which span 3 domains and 15 modules. The Care Coordination Patient Safety domain includes 2 GPRO measures, each its own module. The Preventive Health domain includes 8 GPRO measures, each its own module. And the At-Risk Population domain includes diabetes, with 1 individual measure and 5 component measures scored as 1 composite measure, hypertension with 1 GPRO measure, ischemic vascular disease with 2 GPRO measures, heart failure with 1 GPRO measure, and coronary artery disease, which has 2 component measures scored as 1 composite measure. Sampling Step 3, Beneficiary Sampling. In Sampling Step 3, CMS samples beneficiaries for each module. Beneficiaries are flagged to indicate whether they are eligible for each module based on measure criteria, for example, a diabetes diagnosis. Beneficiaries are sampled for each module. 616 beneficiaries are sampled for large GPROs with 100 or more eligible professionals, which is the required 411 patients plus a 50% oversample for each module. 327 beneficiaries are sampled for medium GPROs with 25 through 99 eligible professionals, which is the required 218 patients plus a 50% oversample for each module. When beneficiaries are selected for the sample, they are assigned a rank. The rank is the order in which the patient is randomly selected from the qualified pool of patients for a group. Patients are ranked from 1 through 616 for large GPROs. For modules with fewer than 616 patients available from the GPRO, 100% of eligible patients are ranked for the module. Patients are ranked from 1 through 27 for medium GPROs. For modules with fewer than 327 patients available from the GPRO, 100% of eligible patients are ranked for the module. ACO and PQRS GPRO beneficiary sampling. To reduce the burden on practices, CMS has adopted a two-step process to reduce the number of medical records a shared savings ACO or PQRS GPRO is required to abstract by maximizing the overlapping patients. An initial random sample of beneficiaries is pulled and used to sample into measures on the general population without chronic disease, that is, most PREV measures and CARE 2, overlapping patients with similar but not identical ranks. We then use the initial random sample to sample into other modules, that is, diabetes, ischemic vascular disease, hypertension, heart failure, and CAD, or measures, that is, PREV5 and CARE 1, that have more elaborate criteria. When a module or measure has fewer than 616 or 327 beneficiaries after the initial pull, additional beneficiaries are randomly sampled from the group of beneficiaries eligible for that module. Reporting on sampled patients. Patients will be assigned a rank between 1 and 616 for ACOs and large GPROs, or 1 in 327 for medium GPROs, based on the random order they are populated into each denominator sample. This represents a 50% oversample of the target sample size to allow for cases in which sampled patients are not qualified for a particular module. For example, the ACO or GPRO could not find the patient's medical record. In these cases, the ACO or GPRO will move on to the next consecutively ranked patient until they have completely reported on the target sample for each module or until there are no additional patients to abstract into the module. ACOs and GPROs will be required to report on the required number of consecutively ranked Medicare patients with respect to services furnished during the measurement period. ACOs and large GPROs with 100 or more eligible professionals will be required to report on 411 consecutively ranked patients. Medium GPROs with between 25 and 99 eligible professionals will be required to report on 218 consecutively ranked patients. Denominator inclusion and exclusion criteria for some modules may mean that reaching the target sample size is not possible for ACOs or GPROs. In this case, the organization must complete abstraction on 100% of the sampled patients. Here is a list of some helpful specifications documents: the 2013 GPRO Web Interface Measures List, Assignment Document. Note that there are separate documents for ACOs and PQRS GPROs, the Sampling Document, Narrative Specifications, Supporting Documents, and a Performance Calculation Flow. All of these documents are available on the GPRO Web Interface portion of the cms.gov website at this link. The 2013 GPRO Web Interface Measures List, which is for PQRS GPRO only, is a list of all measures and modules to be reported in the web interface, the measure title, Measure Steward Identification, GPRO Web Interface Measure Number, NQF Measure Number, PQRS Claims/Registry Measure Number. Again, this measures list is available on the GPRO Web Interface portion of the cms.gov website at this link. The 2013 ACO measures list is available on the Shared Savings Program portion of the cms.gov website at this link. The 2013 GPRO Assignment and Specifications document includes details on the assignment methodology used to determine the population of Medicare patients that may be used for the GPRO Web Interface sample. It includes a list of provider types and primary care visit codes, and it also describes data sources used for analysis. Again, this document can be found on the GPRO Web Interface portion of the cms.gov website at this link. The Shared Savings Program ACO Shared Savings, Losses, and Assignment document, which is for Shared Savings Program ACOs only, provides details on the assignment methodology used to determine the population of Medicare patients that are assigned to an ACO and may be used for the GPRO Web Interface sample. It includes a list of provider types and primary care visit codes and describes data sources used for the analysis. This Shared Savings Program ACO document is available on the Shared Savings Program portion of the cms.gov website at this link. Look out for these other 2013 PQRS GPRO webinars on the CMS YouTube site at this link. These include 2013 PQRS GPRO 101, Parts 1 and 2, GPRO Reporting Mechanisms, Parts 1 and 2, the GPRO Value-Based Modifier, a Measures Overview, Public Reporting, the 2013 PQRS GPRO and ACO Web Interface Submission-IACS, and the 2013 PQRS GPRO and ACO Web Interface Measure Specification Supporting Documents, Parts 1, 2, and 3. Please also check the CMS YouTube site for this upcoming webinar, the CAPS Overview. For more information, please consult the GPRO section of the CMS PQRS website at this link. For Medicare Shared Savings, please go to the Shared Savings Program portion of the cms.gov website at this link. You may also contact the Quality Net Help Desk Monday through Friday, 7 a.m. to 7 p.m. Central Time, via email at qnetsupport@sdps.org, via telephone at 866-288-8912, for TTY 877-715-6222, or via fax at 888-329-7377.